Hi, everyone. This birth control and sexually transmitted infections presentation is brought to you by Titanwell. So, Titanwell is the health promotion services at Cal State Fullerton. I want to also mention that this is a safe space for everyone, and we will be discussing more sensitive topics. Let's begin. Which of these are birth control methods? Thank you for your response. So, first, we have a pretest. You may pull it up on your browser by either typing in the link or by scanning the QR code with your phone's camera. This is just to gather your prior knowledge before the presentation, and it should take about 3 to 5 minutes. Who we are. So this slide is just to reiterate about who we are in Titanwell. So we are Titanwell's peer health educators here for you. We work with students to help empower themselves to make healthier decisions during their time in college, as well as in their futures. We don't tell students what to do, but instead provide Titans with the knowledge and resources to help and encourage those healthy choices. We also work with the professional staff at the Student Wellness Center to provide students with the most up-to-date information, whether that is through our presentations, our handbills, social media posts, and anything else that we are presenting to our Titan community. And we are students ourselves, so we go through the same struggles as all of you. We are all in this health journey together, trying to make healthier decisions. Here is a brief overview of what we will be covering in today's presentation. We will be going over birth control methods, including what works well and what does not work at all, as well as how it works. Barrier protection methods, such as internal external condoms and dental dams. Sexually transmitted infections, but I will be referring to this as STIs throughout the presentation. And available resources for students both on and off campus. So here is a bit.ly link that provides more information on birth control. Feel free to open the link on your phone if you would like it for future reference, or to follow along during the presentation. And remember, the link is case sensitive, so make sure to capitalize BCM. Now we will go into the forms of birth control that work well. First is the implant. It is a hormonal type of birth control that lasts up to 3 years. It is 99% effective and basically just as effective as sterilization when it is implanted. It is also considered a LARC, so a long-acting reversible contraceptive, which means that as soon as this form is removed, it is completely reversible. So you could potentially become pregnant the day you get it removed. So it is important to be diligent about reinsertion or maybe choosing another birth control option. The next one is the IUD. There are two forms, the hormonal and non-hormonal. The hormonal form is progestin only and lasts about 3 to 5 years. Various brands are Skyla, Marina, and Kyleena. The non-hormonal form is the copper IUD, also known as the Paragard, which can last up to 12 years. Both of these are considered LARCs, but are basically just inserted through the cervix and sits in the uterus. This form is also just as effective as sterilization when implanted. And next we have is sterilization, which typically is not recommended for our age group, but could be an option for the future. It can be for men or women, so as either a vasectomy or tubal ligation, which is when you get your tubes tied. And the last one is abstinence. This is as practiced because the term can mean different things for different people. For example, for someone it could mean abstaining from all forms of sexual activity, but for someone else it could mean abstaining from vaginal sex, but engaging in anal sex. Why do you all think these forms of birth control work the best? Great, thank you for your response. So there is less room for human error because most of these are performed by either a doctor or physician, so there is a less chance for it to be messed up or forgotten. What works okay? Here are some other forms of birth control that work just okay due to more room for human error. So the pill is 99% effective with perfect use and 91% effective with typical use. It comes in two forms: the mini pill, which is progestin only, and the combination pill, which is progestin and estrogen both combined. This form of birth control is taken every day at around the same time, but there is a 4-hour window where it can still be just as effective, so 2 hours before and 2 hours after the normal time. The last row in the birth control pill packet is a different color resembling the placebo week, typically made out of sugar or iron, which allows for a period. You can either always know when you're going to get it or you can decide to skip it. The patch is 99% effective with perfect use and 91% effective with typical use. It is a hormonal patch placed on either the shoulder, butt, or hip. It is reapplied every week and then skip the week at the end of the month if you do want to get your period, but if not, continue reapplying the patch. There is only one tone of the patch offered, so it doesn't match everyone's skin color. It is not as discreet, and there is a potential it could fall off because it is on the external part of the body. The ring is self-inserted for 3 weeks, and then removed for 1 week when you would get your period. It can be removed during sex, but it must be placed in right after, and it can be outside of the body for about 2 hours. And then the shot. It's also referred to as the Depo-Provera and is done every 3 months, so you do have to keep up with your appointments. What does not work as well? So the pulling out method is about 78% effective, but your partner may not know exactly when they will ejaculate, so they would have to be very in tune with their bodily signals. Also, pre-cum can contain sperm. The fertility awareness method. It's 76 to 78% effective, but it does involve taking your basal body temperature every single day and noting it either through an app or notebook. So this might not be ideal for busy college students because it does involve a lot of work and can be complicated with busy schedules. The diaphragm. So this one's not really used by your generation. You do have to get it fitted by a physician, and application can be difficult to get it just right. But it's basically a guard that lays over your cervix to not allow sperm through. And then condoms. So these are under the category of not working as well, just because not everyone knows how to effectively use condoms. Although condoms are great at preventing STIs, they are not ideal for preventing unintended pregnancies. However, these methods might not work great on their own, but they can be very effective when paired with another method. So for example, using a condom and an intrauterine device or birth control pills. What does not work at all? First is sex during your period. So ovulation can occur at different points throughout a cycle if it is irregular, and sperm can live in the body for 3 to 5 days. So for example, if you do have sex on the last day of your period, and 4 days later you ovulate because you have an irregular cycle, you could potentially become pregnant. The next one, peeing after sex. So first, these are different anatomical structures. And although peeing after sex does help prevent UTIs, which are urinary tract infections, it does not help prevent pregnancy if there is sperm inside of the vagina. Douching. This is basically when someone injects a scented liquid into the vagina in hopes to make it smell better or clean it out in some way. This can disrupt the vaginal pH system, which is very sensitive and can actually serve as a jetpack to sperm that is already in the vagina, so we don't recommend douching for any reason. And the last one is doubling up, which can mean either 2 internal condoms one external and one internal, or two external. So the friction caused by doubling up can cause the condoms to break and therefore be ineffective as a birth control option. So now that I've gone over different forms of birth control, I'll go over now how it works. So this model slide explains briefly how hormonal birth control works, but I will also include how non-hormonal birth control works as well. So for hormonal, it prevents ovulation, so that means an egg is never released. It also thickens the mucus in the cervix, so the mucus is thicker and harder for sperm to swim in. And it thins the uterus lining, so if an egg is fertilized for somehow, the uterus lining is so thin it cannot implant into the uterine walls. And then for non-hormonal birth control, the copper reflects the sperm because it creates an unsafe inflammatory atmosphere in the uterus. So here are some common symptoms that people experience when using birth control. It's important that although you should do your research when deciding for yourself, it is also important to keep an open mind. You might not experience them, or you may experience different variations of them. So common symptoms include spotting, bleeding between periods, heavier periods / no period, acne, mood swings, cramps, headache, and sore breasts. Different birth control methods have different symptoms. So for example, for no period and cramps, those are typically associated with the non-hormonal copper IUD. What other symptoms have you all heard of that are not listed on this slide? In case of an emergency, here are a few different emergency contraceptive options. The copper IUD. So this is the most effective form of emergency contraception. And once it is inserted, it is an effective birth control method that lasts for an additional 12 years. The only downside is that it might be hard to get an appointment within 5 days of having unprotected sex because it must be inserted by a physician. The next one is called Ella, which is the most effective emergency contraception pill. However, you do need a prescription to access it. This works best within 5 days of unprotected sex as well. And then there's Plan B, which is usually the one most people have heard of. This is the most accessible type of emergency contraception and works best within 3 days of unprotected sex. It is available at the Student Wellness Center pharmacy at a lower cost than outside providers. And lastly, just a reminder that emergency contraception helps stop you from becoming pregnant, but it won't work if you are already pregnant. These are not abortive medications. Here are some different birth control myths. I need to take the birth control pill at the same time every single day. It is important to take it around the same time every day to be the most effective. However, there is a 4-hour window, so 2 hours before and 2 hours after the normal time. Birth control works immediately when I start taking it. So this does depend on the form of birth control that you are taking. So for the IUD or arm implant, these forms work immediately after insertion on your period. However, for the ring, the patch, the pills, you might have to wait a little bit, but make sure you are checking with your physician. Birth control will make me gain weight. So the only birth control that is associated with weight gain is the Depo-Provera, also known as the shot, typically only 5 to 10 pounds. I won't get my period if I'm on birth control. For most forms of birth control, you will still get your period, but for some you can manipulate your period, such as pills, the patch, and the ring. Birth control will affect my fertility. So for birth control, it will not affect long-term fertility. LARCs are 100% reversible, and some other forms it might just take a while for the body to adjust back, but it will not affect long-term fertility. IUDs are only for women who have had children. So IUDs are now made in numerous sizes for uteruses who have not had children yet, such as the Kylina and Skyla. So IUDs are for people who have had children and for those who have not had any children. Next, we will move on to different barrier protection methods. Condoms. The internal condom is also referred to as the female condom. It is 95% effective with perfect use and 79% effective with typical use. It is unfortunately available through prescription only and comes in non-latex. The external condom. This is also referred to as the male condom. It is 97% effective with perfect use and 82% with typical use. This is available in latex and non-latex. At the end of the presentation, we will let you know how to get free condoms through the Student Wellness Center. On the next slide, we will go over the 10 steps of how to put on an external condom. So before I move on, what do you all think is the first step in properly putting on a condom? So these are the 10 steps of proper condom use. The first step is talk. This is where consent occurs. We like to think of consent as an acronym of consent phrases. So F for freely given, it is not coerced or pressured into giving consent for any type of sexual activity. R for reversible, meaning although it can be given, it can also be taken away at any point engaging in sexual activity. I for informed, so all participating parties are aware of the activities that will take place and have asked all pertinent questions regarding STI status and testing, birth control, and barrier protection methods, and any other important information. E for enthusiastic. Consent is given with a positive and enthusiastic yes, so it's not just a sure or an okay. S for specific. It is given for specific sexual behaviors that will happen and continually given for all others. For example, it can be given for oral sex, but not for anal sex. And lastly, S for sober. No alcohol or drugs are in anyone's system because it is impossible for a person to give consent if they are intoxicated. The second step is check the expiration date. This is important because just like anything else that contains an expiration date, it is just making sure that it is still good to use. So if it is also a condom that includes lube, the lube might be dried out if it is expired, or it might just be more susceptible to breaking. The third step is squeeze the condom package. When you squeeze it, it should have an air bubble that forms to show that no one has tampered with it. Step 4. Carefully open the package with your hands and not your teeth or scissors so that you don't accidentally rip the condom as you're opening the package. Step 5. Pinch the tip of the condom. So make sure it looks like a sombrero and not a party hat so it is easier to roll down. We also include pinching the tip so that it leaves room for ejaculation. Step 6. Carefully unroll to the base of the penis. It is important in this step to cover as much area on the penis as possible. Step 7. Intercourse. Step 8. Ejaculation if it does occur. Step 9. Hold on to the base of the penis and the condom. Step 10. Carefully withdraw from your partner, making sure you are holding onto the condom. And when you take off the condom, carefully do so away from your partner and dispose of it in the trash and not the toilet. Here are different barrier methods for oral sex. Dental dams are latex sheets that look like fruit roll-up. It is used for oral sex with the vulva or anus. And if you are allergic to latex, we have a DIY demo for dental dams with a non-latex condom, and then you can pair it with a flavored lube. Next is flavored condoms. These are also used for oral sex, either with a penis or a sex toy. Why do you all think these barrier methods are only used for oral sex? So it's important to note that these barrier methods are only used for oral sex because of the sugars that are involved. Sugars can disrupt the vaginal pH system and cause infections. Lube it up. So the good types of lube to use are water or silicone-based. Brands include Astroglide and Wet. And the bad types of lube are oil-based lube because it breaks down the condoms, whether latex or non-latex. So Vaseline oil and other food lubricants are not good to use because they can cause infections. Before I move on to the next slide, where do you all think these barrier protection methods go once they are used? Always remember after using barrier protection methods, whether that be internal, external condoms or dental dams, that you trash them and not flush or reuse them. If flushed, it might clog the toilet and come right back up. It's also important to be aware of where you are storing your condoms. So don't store it in the sunlight because it can break down the condom, or purses because there might be a pen that can poke a hole in the condom package, or any of these other areas listed on the slide. This is a sexually transmitted infection info sheet link. Feel free to pull it up on your own browser for more information on STIs. And the link is case sensitive, so make sure to capitalize STI. Here are different sexual behaviors and the risk associated with them. So for vaginal sex, pregnancy and STIs are risks associated. There's an asterisk by pregnancy because if the participating members have vaginas, then there's no risk for pregnancy. And then for oral and anal sex, there is the risk of STIs. Here we have a risk continuum of high, moderate, and low risk. Under high risk, there is unprotected anal, vaginal, and oral sex. Under moderate risk, there is the sharing of sex toys, hand-to-genital contact, and barrier methods. And then under low risk, we have activities that do not involve the exchange of body fluids and abstinence. So this is a sexual health risk continuum, which means risk can vary on different areas of the chart dependent on certain factors. So regardless of the categories listed above, risk is constantly changing. So because risk is often on a continuum, something that is a high-risk behavior can potentially change to a moderate or low-risk behavior. For example, under the high-risk category, for unprotected anal sex as practice can be reduced to a moderate risk by being in a mutually monogamous relationship. If you have multiple partners, that increases your likelihood of contracting or transmitting an STI. And for example, under the moderate risk category for the sharing of sex toys, we highly recommend that when you're sharing the sex toys with your partner, that you use a condom with it, such as an external or internal condom. Barrier methods falls under moderate risk because oftentimes people do not know how to put on a condom properly. But barrier methods can move to the low risk category by learning how to properly put on a condom and maintaining the condoms that you currently have correctly by storing it in the right places so that you partake in safer sex practices if you do decide to engage in sexual activity. And under low risk, abstinence is not a no risk behavior because this term can mean different things to different people. For example, for some people, it could mean abstaining from all types of sexual behaviors, but for another person, it could mean abstaining from vaginal sex, but not oral sex, so that can change the risk. So this is why we put abstinence under low risk and not no risk. And it is important to have that open sexual communication to make sure all participating members are on the same page. Here is a terminology slide. MSM stands for men who have sex with men, and WSW stands for women who have sex with women. It is important to remember that sexual identity and orientation do not dictate risk. Sexual behavior is what dictates risk. So sexual identity and sexual behavior aren't always the same. Sexual behavior is what determines the level of risk. And not all women who have sex with women and men who have sex with men identify as gay, lesbian, or bisexual. So behavior is what dictates risk, not sexual orientation or identity. sexually transmitted infections. Here's a statistic that we like to put in all of our presentations just because of how important it is. So 1 in 2 sexually active young people will get an STI by the age of 25, and most will not know it. This is not used as a scare tactic, but instead to demonstrate the importance of getting tested regularly. The last part, most will not know it, is because a lot of STIs are asymptomatic in people, meaning that they do not show any symptoms. Another takeaway is to get tested regularly. So what that looks like is every 3 months or with every new partner, whichever comes first for non-mutually monogamous relationships. And for mutually monogamous relationships, that's every 6 months or once a year. Next, we will go into some common STIs and the rates associated with them. Before moving on, think of whether this statement is true or false. All STIs are curable. So the statement was false. Although STIs are not all curable, they are all treatable and livable. Chlamydia. This is the most diagnosed STI at Cal State Fullerton. On our campus, it's typically found in the throat, the penis, vagina, and anus. It is curable with antibiotics and can be transmitted by engaging in unprotected vaginal, anal, or oral sex. Also, feel free to take pictures of the slides throughout the presentation if you would like to keep the information for future reference. Gonorrhea. This is the second most diagnosed STI at Cal State Fullerton. It is curable with antibiotics, and this STI can be spread through unprotected vaginal, anal, and/or oral sex. Syphilis. This is curable with antibiotics. It is transmitted by contact with the syphilis sore during vaginal, anal, and oral sex, even if there is no sexual penetration. Syphilis can lead to a serious health condition in the nervous system if left untreated, but it is not as uncommon as people think. HIV, also known as the human immunodeficiency virus. It can be transmitted through blood, breast milk, semen, vaginal, and rectal fluids, as well as unprotected vaginal, anal, or oral sex. HIV and AIDS are referring to the same virus, HIV. AIDS is the later stage of HIV and refers to a certain threshold of cells being present in the body. HIV is very treatable now. PrEP and PEP are now used as preventative measures for HIV. The human papillomavirus, also known as HPV. HPV is very unique. It is transferred from skin-to-skin contact. There is a vaccine for it called Gardasil, which is available at the Student Wellness Center. HPV can cause cervical, uterine, vulvar, anal, head, and neck cancers later in life, which is why the vaccine is very important for men and women. It mostly clears from the body on its own. However, it can stay in the body and can turn to cancer. It is typically asymptomatic, meaning it does not show any symptoms. Herpes simplex virus, or HSV. HSV1 is more likely to occur on the mouth, and over 50% of American adults have HSV1. HSV2 is more likely to occur on the genitals and anus, and 20% of people over the age of 14 have HSV2. HSV1 and 2 can switch locations. So for example, if you have HSV1 cold sore and perform oral sex, that person will get HSV1 on their genitals. This slide is just to emphasize how important it is to get tested and know your baseline. Once you know your baseline, it is important to have that open sexual communication with your partner. Knowing your baseline will help reduce the risk and increase the pleasure. The Student Wellness Center offers free testing through Family Pact. On the next slide, I will briefly go over what Family Pact is and resources if you want to know more information. Family Pact. This is a state-funded program, meaning it only works in California. It provides family planning and family planning related services to those eligible at no cost. If an individual meets the eligibility requirements, they will have access to free STI screening and treatment, HIV testing and counseling, pap smears, emergency contraceptives, birth control options, and other services. At CSUF, we also have a family planning specialist at Student Wellness. Feel free to make an appointment if you have further questions. Condom and special barrier requests. So here at Titanwell, we have a condom availability program, which offers free lube and barrier protection methods, such as external and internal condoms and dental dams. CAP offers 4 options, including 3 pre-packaged options and 1 customizable option that you can choose from. Place your order for pickup by scanning the QR code or using the link located at the bottom of the slide. And then you will receive an email confirmation when your order is ready for pickup. CSUF resources. So here are just some of the resources that CSUF offers. There's Student Wellness Center, Diversity Initiatives and Resource Center, also referred to as DIRC, which provides support to the Titan community to expand their cultural competence and identity development. Titan Recreation, also known as the SRC. Division of Student Affairs Women's Center. Tuffy's Basic Needs Services, which provides students with support via food, short-term housing, hygiene products, clothing, and emergency grant funds. Associated Students Incorporated, which is the student leadership on campus. Titanwell and the Titanwell Hut, educating and empowering students to help make healthier decisions. Sexual health resources. Here's some different on and off campus sexual health resources. So there's Student Wellness, Orange County Health Department, the Center OC, Radiant Health Centers, the STI fact sheet, make sure to capitalize STI, the birth control fact sheet, make sure to capitalize BCM, condom request link, Centers for Disease Control, Planned Parenthood, and Bedsider, which is an app that you can compare different birth control methods. So feel free to DM your questions and comments that you may have to our Titanwell Instagram @Titanwell, or check out our website for more information. Titanwell also has a health educator if you would like to set up a one-on-one appointment for further questions regarding sexual and reproductive health. And lastly, we have a post-test for you all to complete. You may pull it up on your browser by either typing in the link or by scanning the QR code with your phone's camera. This is just to gather your knowledge after the presentation, and it should take about 3 to 5 minutes. I want to thank you all for engaging and listening along to this birth control and STIs presentation, and I hope you all have a great day.